Here you can see the posterior compartment of the leg. Posterior compartment of the leg has two layers, superficial and deep layer. You can see from the lateral view, here's a superficial layer, and we also have deep layer here. Here is a deep layer from the medial view. Here is the superficial layer. In the superficial layer of the posterior compartment, we have three muscles. Here is the first one that you can palpate it. It has two heads. It is called Gastrocnemius. Here is the medial head. It's the big toe. So here is the medial head. It's the little toe. Is the lateral head. Lateral head, medial head of the Gastrocnemius. They are, if I take the muscles away to show you the origin of the medial head and lateral head of the Gastrocnemius. As you see, here is the medial head of the Gastrocnemius. It's coming from the femur. It attaches to the medial supracondylar line, and the lateral head attaches to the lateral supracondylar line. I'll show you on the bone here. Here is the condyle, lateral condyle. Here is the medial condyle. Here is the head. Here is the medial condyle. So above the condyle, we have line or ridge, lateral supracondylar line and medial supracondylar line. So the lateral head attaches to the lateral supracondylar line. Medial head, vice versa. Here is the medial head attaches here. Oh, yes. Yeah, medial head attaches to this part. Medial supracondylar, lateral head attaches to the lateral supracondylar line. And then its tendon goes down and attaches to the calcaneus via calcaneal tendon or Achilles tendon, or calcaneal tendon. The second muscle in the superficial layer is this muscle. It is called Cellulous Muscle. You can see here is the Cellulous Muscle. Cellulous Muscle is coming from the, I'll show you in the tibia. It attaches to this line. Here is the cilial line. It also attaches to the fibula. If I put the fibula next to the tibia, you see here is the fibula. So Cellulous muscle has a U-shape attachment. It attaches here as a U-shape, so it attaches to the cilial line of the tibia and the posterior surface of the shaft of tibia, and it also attaches to the fibula. And then its tendon attaches to the calcaneus via the calcanean tendon. I mean, medial head and lateral head of the gastrocnemius and cilius. All these three muscles make a single tendon, which is called calcaneal tendon or Achilles tendon. It's one of the strong tendons of the body, and it attaches to the calcaneus. These three muscles, medial head, lateral head of the gastrocnemius and soleus, these three muscles are called triceps suri. Tri means three, ceps means head, three heads. Suri means leg. The muscles that three heads, posterior of the leg. The third muscle from the superficial layer is plantaris. Here is the plantaris. It is small muscle. It attaches again to the lateral supracondylar line above the attachment of the lateral head of the gastrocnemius, and it also have a large and long ligament. It goes down between the gastrocnemius and cilius, and it attaches to the calcaneus next to the medial side of the calcaneal tendon. So, as a quick recap, I'm showing you the posterior compartment muscles of the leg. It has two layers, superficial layer and deep layer. In the superficial layer, we have three muscles. Gastrocnemius, it has two heads. I showed you that it has two heads, medial head, lateral head. Deep to the gastrocnemius, we have cilius, and between the gastrocnemius and the cilius, we have the tendon of the plantaris. So if you look at accurately which muscles crossing which joints, so you can anticipate and guess the action of these muscles. If you look at here, you see the gastrocnemius crossing the knee joints. It's also crossing the ankle joint, so it can do actions on both knee joints and ankle joint. But if you look at here, cilius attaching to the tibia and fibula, not femur, so it's not crossing the knee joint. It is just crossing the ankle joint, so it can do actions just on the ankle joint. So what is the action of these muscles? All these three muscles, I mean gastrocnemius, cilius, and plantaris, attaches to the calcaneus, so they can do plantar flexion. They can do this. If they contract, they can pull up the calcaneus and do plantar flexion. But as I mentioned before, gastrocnemius and plantaris also attaches to the femur and crossing the knee joint, so they can do flexion of the knee. In addition to do plantar flexion, they can do flexion of the knee because they are crossing the knee joint posteriorly. And I will show you in the monitor. Yeah, you see here, cilius can do just plantar flexion, but gastrocnemius and plantaris, they are crossing the knee joint as well. In addition to do plantar flexion, they can do also flexion of the knee joint, you see here. But the plantaris is so weak. Gastrocnemius is so strong, it's stronger than the plantaris. So here's the superficial layer. We have deep layer. The deep layer, we have three long muscles and one short muscle. I will start by having a look at the short muscle. It is called Popliteus because it is located in the popliteal area. Here is the popliteal area. It is called Popliteus. So as you see, it attaches to the lateral condyle of the femur. Here is the condyle, lateral condyle of the femur. I'll show you the palm. Here is the lateral condyle of the femur. It attaches to the lateral condyle of the femur and goes down and attaches here to the tibia. So what is the function of the Popliteus? As you see, it's crossing the knee joint posteriorly, so it can flex the knee joint like gastrocnemius and plantaris. Flex the knee joint, and it also medially rotate the knee joints because it attaches to the medial side of the knee joint, so it medially rotate the knee joint. What about the three long muscles? Here is the big toe. On the big toe side, we have flexor digitorum longus, but on the other toe side, we have flexor hallucis longus. It's a vice versa. The big toe side, we have flexor digitorum longus. On the other toe side, we have flexor hallucis longus. Between these two, we have tibialis posterior. Here is the tibialis posterior. And their tendons go down and cross them, pass behind the medial malleolus and pass through the sole of the foot. And as you see here, the tendon of the flexor hallucis longus attaches to the distal phalanx of the big toe, and the tendon of the flexor digitorum longus attaches to the distal end of these muscles, distal flanks of these muscles. What about the tibialis posterior? After passing behind the medial malleolus, it attaches here, close to the attachment site of the tibialis anterior, here, the base of the first metatarsus and medial cuneiform. So what is the function of these three muscles? As its name suggests, flexor digitorum longus, they can flex these four toes. Flexor hallucis longus, flex the big toe, and tibialis anterior helps the tibialis posterior helps the tibialis anterior and fibularis. Tibialis anterior and tibialis posterior, they can do inversion of the foot. Three muscles, fibularis longus and brevis and tertius, they can do eversion, but tibialis anterior and tibialis posterior, they can do inversion, eversion. And they also all, as you see, all these muscles crossing the ankle joint posteriorly, they can also do plantar flexion. The strong muscle doing plantar flexion was the superficial layer. I mean, these three muscles, Cellulous, Gastrocnemius, and Plantaris, can do plantar flexion, but they can also, this deep layer also help them to do plantar flexion. Thank you.